Okay, let's jump right into this deep dive. Today, we're looking at something you might have seen in your own dog or cat. Excessive drooling. It seems pretty straightforward on the surface, doesn't it?
It really does. But, the information we've gathered shows it's often anything but simple. We're really digging into Ptyalism today.
Ptyalism, right. And the first key thing, based on the sources, is getting that definition clear.
Exactly. Ptyalism is specifically the excessive production and secretion of saliva. It's the body actually making too much.
Okay, so it's not just pooling.
Right. That's pseudoptyalism. That's where saliva production is normal, but the animal can't swallow properly, so it spills out. Think of it like a plumbing backup versus the factory working overtime. Ptyalism's the factory in overdrive.
Got it. Factory overdrive. So our goal here, using all this information, is to understand what cranks up that factory, what other clues might show up alongside the drool, and how vets actually figure out what's going on underneath.
Precisely.
Yeah.
And it all starts with the basic biology, right? Salivary glands they're always producing some saliva. It's a constant thing.
But that production really ramps up when certain parts of the brainstem get a signal, the salivary nuclei, I think they're called.
That's them. Taste and touch inside the mouth are really common triggers. But interestingly, higher brain centers can play a role too, kind of dialing production up or down.
So it's not just automatic reflexes.
Not entirely. And there are completely normal reasons for more drool. Like, just thinking about dinner time. That anticipation?
Yeah, the dinner bell effect.
Definitely. Or getting too hot, hyperthermia. That makes sense. And here's a fun one from the sources, especially for cat owners. Purring can sometimes lead to more saliva.
Purring drool. Okay, I hadn't heard that one. But all right, those are the normal instances. The information also stresses that extra drool can definitely be a red flag, signaling something's up, maybe with the GI tract or even the nervous system.
Yes, that's when it shifts from normal to needs investigation. And that brings us to looking beyond just, the puddle on the floor. What other signs might owners notice?
Right, the history part, like changes in how they eat. Maybe they're suddenly off their food, or they won't touch the hard stuff.
Or they hold their head funny when they try to eat, or food just falls out of their mouth. And behavior shifts, too. Maybe they seem more irritable or they hide away, especially if something in their mouth hurts.
Okay. And difficulty swallowing dysphagia, that sounds like a big one. It could be either true ptyalism or that pseudoptyalism we talked about.
Exactly. And signs of nausea often go with it. Things like excessive lip smacking, maybe swallowing repeatedly, or even actual regurgitation or vomiting.
Which, if it goes on long enough, could lead to weight loss, right? If they're not eating properly.
Absolutely.
Or
Or you might just see them pawing at their face or muzzle. That's a pretty clear signal something's bothering them in there.
the sources also mention looking out for neurologic signs appearing with the drooling, as that could point towards certain toxins or specific conditions.
Yes. And then during the actual vet exam, there are specific things they're looking for. Obvious stuff like dental disease, gum disease, inflammation,
Gingivitis, yeah.
right? Or broader inflammation in the mouth. It's called stomatitis. And that can have tons of causes itself, toxins, immune issues, even viruses like FeLV or FIV in cats, or that uremic state from kidney failure.
Wow. Even like chewing on an electrical cord.
Yep, can cause nasty burns and inflammation. They'll also look for any masses or lesions on the tongue, that's glossitis or problems way in the back, the oropharynx.
What about blood in the saliva? That sounds serious.
It definitely warrants investigation. Suggests bleeding somewhere, maybe the mouth, maybe further down. And bad breath, halitosis, that could be from the mouth or the GI tract. Facial pain is another potential finding.
And dysphagia, again, you might actually see the difficulty swallowing during the exam.
Correct. And the sources pointed out something really interesting about specific nerve problems. Cranial nerves.
How do they tie in?
Well, think about the nerves controlling the face and mouth. If the trigeminal nerve isn't working, they might literally not be able to close their mouth right, so drool just falls out.
Ah, okay.
Or facial nerve issues can cause paralysis on one side, so the lip droops and saliva escapes there. And then there are nerves controlling the throat and swallowing, the glossopharyngeal, vagus, hypoglossal nerves. If they're affected, swallowing can become difficult or impossible.
Leading to that pseudoptyalism, the pooling.
Or just making true ptyalism worse because they can't clear it.
Mm-hmm.
And one more thing, the drooling itself, if it's constant, can cause secondary problems.
Yuck, skin irritation.
Exactly. The skin around the mouth gets damp and inflamed, that's cheilitis. Or even little infections like chin acne.
Okay, so we've got the definition, the other signs, what a vet looks for. Now,
Yeah.
the causes, the sources made it super clear. Ptyalism is a sign, not a diagnosis. And the list of potential causes is huge.
It really is incredibly varied. It starts with something kind of simple, just the dog's build. Think about St. Bernards, Great Danes, Mastiffs.
The big jowly breeds.
Right. Their lip conformation just makes it easier for drool to escape. But beyond anatomy, it gets complex fast. Local problems in the mouth or throat are common.
Things like injuries or getting something stuck, like a stick
Or foxtails, sewing needles, yeah. Plus, growths, abscesses, inflammation from all those things we mentioned. Infections, immune problems, uremia, chemicals, certain plants, even radiation therapy side effects or burns, and issues with the actual nerves or muscles needed for swallowing.
And then the salivary glands themselves can be the problem source.
Yes, things like inflammation of the glands, sialodenitis, or stones blocking the ducts.
Silothiasis.
That's the one. Or unexplained swelling, sialodenosis, cysts called mucosales. Even tumors or foreign bodies in the gland. It's quite a list just for the glands.
Okay, moving down the line. The digestive tract seems like a major player too. Esophagus or stomach issues.
Frequently linked, again, foreign bodies, but this time stuck in the esophagus. Growths, inflammation like esophagitis, acid reflux, even certain infections like sparsicosis or pythosis mentioned in the sources.
Structural problems too, like a hiatal hernia.
Yeah, where part of the stomach slides up. Or functional issues like megaesophagus, that big floppy esophagus, or just poor muscle movement, dysmotility. They all can lead to drooling or regurgitation.
And stomach trouble generally, like bloating or ulcers.
Definitely. Stomach distension, GDV or volvulus, the twisting ulcers, or just general gastroenteritis can all cause nausea. And nausea often triggers increased salivation.
Then there are the metabolic causes. You mentioned liver disease.
Right. Hepatic encephalopathy. Brain issues because the liver isn't clearing toxins, especially seen in cats with things like portosystemic shunts.
Okay. And hyperthermia, getting too hot, we mentioned that as physiological, but it's also a cause if it's severe, right?
Yes. And kidney failure leading to uremia that causes systemic illness and mouth irritation.
And then the neurologic list. This one had some surprises. Rabies, for instance.
Yeah, and interestingly, rabies causes drooling, mostly because it stops them from swallowing. The saliva builds up. It's that pseudoptyalism mechanism again, mostly.
Ah, okay. What else neurologically?
The sources listed pseudorabies in dogs, botulism, tetanus, dysautonomia that affects the autonomic nervous system. Basically, anything causing difficulty swallowing, facial paralysis, or that dropped jaw phenomenon.
Seizures, too. How does that work?
During a seizure, yeah.
Yeah.
It could be the direct nerve discharge stimulating salivation, or just reduced swallowing during the event, may be made worse if they're chomping their jaw.
And nausea from inner ear problems, like vestibular disease.
That dizziness can definitely make them nauseous and drooly. Even anxiety was listed as a potential, though maybe less common, trigger.
Wow. Okay, and finally, drugs and toxins. That list seemed really long.
It is. It covers things that are directly irritating or caustic cleaners, certain plants, things that cause nausea as a side effect, like maybe some anesthesia drugs causing reflux, or pre-meds.
Or even just meds that taste awful, especially for cats.
Yes, the eternal struggle. But then there are substances that are direct stimulants. They actually tell the salivary glands, produce more.
And the sources got specific here. Things like organophosphates.
Yes, found in some insecticides, cholinergic drugs, other insecticides like boric acid, pyrethrins, even ivermectin toxicity in some dogs, or benzoic acid compounds in cats. Some human meds accidentally ingested like clozapine, caffeine, even illicit drugs.
And things from nature. Venoms.
Yep, black widow spiders, Gila monsters, some scorpions, toad and newt secretions were mentioned. And plants, again, not just caustic ones, but things like poinsettias, parts of Christmas trees, or toxic mushrooms like amanita, just mouthing them can sometimes trigger it.
Man, it really drives home how varied the causes are. A physical injury, something they ate, an internal disease. So, faced with all this, how does a vet start figuring it out? It sounds like serious detective work.
It absolutely is. And it starts, like we said, with a really thorough history. The sources emphasize getting vaccination status rabies is always a concern. Medications, any possible toxin exposure, how long it's been happening.
And trying to differentiate true Ptyalism from pseudoptyalism early on by watching the animal. Are they nauseous, licking, or struggling to swallow?
Exactly. Observation is key. Then comes a complete physical and neurological exam, really checking that mouth, feeling the neck, glands, looking for pain or abnormalities. And yes, the practical advice, Wear gloves if rabies is even remotely possible.
Makes sense. After the hands-on stuff, diagnostics, blood tests, urine tests.
Usually the next step. Basic panels, CBC, chemistry, urinalysis, can pick up signs of infection, inflammation, kidney problems, liver issues. The sources mention specific things to look for, like high kidney values or changes in liver enzymes or things the liver makes, like BUN or glucose.
And you mentioned earlier that severe drooling itself can mess up electrolytes.
Yes, potentially leading to low potassium or metabolic acidosis because they're losing bicarbonate in the saliva. So blood tests check for that too. And sometimes more specific tests are needed based on suspicion, bile acids for liver function. FLV, FIV for cats. Maybe antibody tests for myasthenia gravis if muscle weakness is seen.
Imaging seems important too. X-rays.
Definitely. X-rays of the head, neck, chest, abdomen can reveal foreign objects, masses, signs of megaesophagus, things like that. Ultrasound is great for looking at soft tissues, salivary glands, abdominal organs.
And more advanced stuff like CT or MRI.
Might be needed for tricky cases, especially if they suspect something in the brain or complex masses.
What about watching them swallow? Is there a way to do that?
Yes, fluoroscopy. It's like a moving X-ray, so you can actually see the swallowing mechanism in action, or check esophageal motility. It's really useful for diagnosing functional problems.
And endoscopy, looking inside with the camera.
Very valuable. Esophagoscopy or gastroscopy lets the vet see inside the esophagus and stomach directly, look for inflammation, ulcers, foreign bodies, sometimes even remove them and take biopsies.
Biopsies seem key for any weird lumps or bumps.
Absolutely. Getting a tissue sample, whether through biopsy or a fine needle aspirate, is often how you get the definitive answer, especially for inflammation or cancer.
Okay, so it's a step-by-step process, ruling things out, gathering clues. Once they do figure out the underlying cause, what's the treatment approach?
Well, the absolute #1 principle from all the sources is treat the underlying cause. That's the main goal. The Ptyalism is just the smoke. You need to find and put out the fire.
And the sources seemed pretty hesitant about just trying to stop the drooling itself.
Very hesitant. They argue symptomatic treatment, using drugs just to reduce saliva, isn't usually that helpful for the animal's comfort. And more importantly, it can mask the signs you need to figure out the real problem. It might delay getting the right diagnosis and treatment.
So it's generally discouraged unless absolutely necessary.
Right. They suggest it might be considered if the drooling is incredibly severe and prolonged, causing major issues, but ideally only after you have a diagnosis.
Okay, that makes a lot of sense. Don't hide your clues. What about supportive care then? Things you can do while treating the main issue.
Protecting the skin is a big one. That constant wetness is irritating. Using petroleum jelly or maybe mild astringents around the mouth can help prevent chapping and secondary infections.
And nutrition, if they can't eat.
Crucial. If the underlying cause prevents normal eating, nutritional support, maybe with a feeding tube, might be necessary to keep their strength up while they recover, and specific therapeutic diets might be part of the plan for certain conditions, like liver or kidney disease.
Are there any medications used for the drooling itself, even cautiously?
The sources mention anticholinergics like atropine or glycopyrrolate. They do reduce saliva production, but again, used carefully and usually not as the primary treatment. If nausea is thought to be a major trigger, antiemetics might be tried, although their direct effect on the drooling can be hit or miss.
And IV fluids if they're dehydrated.
Definitely. Essential for correcting dehydration and electrolyte imbalances.
Mm-hmm.
And there were a couple of specific medication mentions too. Phenobarbital, sometimes being used for that rare idiopathic hypersalivation where no cause is found, and obviously anticonvulsants if seizures are the cause.
Gotcha. And finally, the sources list potential complications to watch out for.
Yeah, things arising either from the severe drooling or the underlying condition. We mentioned metabolic acidosis and low potassium, dehydration, that moist dermatitis or skin infection around the mouth, and a serious one, aspiration pneumonia, if their swallowing is compromised and saliva or food goes down the wrong way.
It really covers a huge range of possibilities, doesn't it?
It really is. We've gone from just defining drooling to the biology, all of those potential signs, that massive list of causes, from anatomy to toxins to deep internal diseases.
Yeah.
Then the whole diagnostic journey, and finally the treatment focus.
It's really striking how something that seems so simple, just extra saliva, can be a window into so many different health issues. The information pulled together really highlights that interconnectedness.
Absolutely. It shows how finely tuned these systems are and how a problem in one place can manifest signs somewhere else entirely. It's a testament to how much we can learn by paying attention to these signals.
It really is. Which kind of leaves us with a final thought, doesn't it? Thinking about that interconnectedness, how an issue in the mouth or the gut or the liver or even the brain can all surface as, well, just too much drool. What does that tell us about really observing the animals around us? How even small changes might be signals worth investigating. It definitely makes you think twice about a wet spot on the carpet.